Hey guys, what's up? It's Stephanie. I'm back today. I have another video for you guys today. The video for today is going to be a continuation of the previous videos that I've made, basically talking about interview questions or preparing yourself for the PA school interview questions. Basically what type of questions they're going to ask you, how to answer them, and how to prepare yourself for them. So hopefully these videos are helpful for you guys. I will talk about my experience, how I answered them, examples of questions, and the types of questions they will ask you. It's four different categories, and I'll give an example of each question category. So hopefully this video helps you guys out. I want to be able to prepare you guys and for you guys to be prepared so you guys can crush those interviews. I know that when I was preparing myself for interviews, it was really nerve-wracking, and I was looking online and on YouTube for the questions that they would ask me and how they answered them or how I can answer them, etc. So hopefully this video helps you guys out, because I was just in your guys' shoe last year. And if you guys do have an interview, make sure you comment below so I can congratulate you guys, because that is a huge accomplishment, is just getting your interview. Once you ace that interview and you crush it, you will get accepted. Whether it's only one interview, all you have to do is just crush that single interview and you will get accepted to PA school. So hopefully these videos help you guys out, motivate you guys. I know it's a long process, applying and then waiting for your interview and then interviewing. So it's a long process, but just be patient, stay motivated, persevere, and you guys will get into PA school. So hopefully this video helps you guys out. So once again, I will be discussing the 4 types of questions or category of questions that you will be asked in your PA school interview. I'll give you an example of each one. Now, I did want to make more videos in the future on each category, because I don't want this video to be extremely long. Like I've said in my previous videos, I feel like my videos are too long, and I'm trying to prevent that. I'm trying to make them concise and brief, so you guys don't have to sit there and watch me talk for like 10-20 minutes. I know I tend to ramble, which I'm doing right now, so I'm going to try to prevent that. Alright guys, if you guys are interested, keep watching and we'll talk about questions soon. Alright guys, talk to you soon. Okay, so you've got your interview, and now you're preparing for your interviews, and you're asking yourself, well, what type of questions are they going to ask me besides the most frequently asked questions? So this is a question I had, and from my experience and also from preparing myself for these interviews, the 4 categories of questions that they will ask you are, the first one will be traditional questions. They're known as traditional questions because they are the most commonly asked questions. Not all of these traditional questions will be asked, but you will expect to have at least one of these questions asked in your interview. And these questions are the most commonly ones is, why do you want to become a physician assistant? Tell me something about yourself. What are your weaknesses? What are your strengths? Etc. So these are the traditional questions that they will ask you. So it's really important to prepare yourself for these questions. The número 2, second type of question that they will ask you will be the behavioral questions. So these questions will basically ask you to describe a situation and to inform the staff how you handled it. So what does the admissions committee get from these type of questions? They get to know a little bit more about yourself, the skills that you have, the knowledge you have, whether it's in healthcare, about the PA profession, and also the experience you have, what experience you bring to the program. So these are why these questions are asked. So they'll ask you a question of, for example, give an example of a situation that you handled that was stressful, or tell me how you handled a stressful situation. Describe an interaction that you had with a patient that made an impact on you. Another one, give me an example of where you had to show your leadership skills. An example of where you showed your organization skills. So for these questions, it's really important to prepare, of course, beforehand, but also to have an example ready. For a stressful situation, I had the example of working in the ER, having to work under quick, stressful situations because you don't know what's coming in through the door. You don't know if you go in one day and it's going to be slammed or it's going to be slow. So pick a specific example of how you handled the situation. For me, I remember one time that we were really short-staffed, not only in my department of the admissions committee, but we were also short-staffed with the nurses. And so it was horrible because it was during the flu season and we had so many patients. And I practiced this example so that when they asked me, describe to me an example of how you handle such a stressful situation, I was able to provide this example, and I was also able to provide how I handled the situation. So this is a type of behavioral question that they will ask you. Número 3, it's going to be your ethical questions. It will test your ethics, morals. Basically, they'll give you an example and they'll ask you how you would act in this example or in this situation. One of the questions that I was asked was, what would you do in a situation that you had a Jehovah's Witness patient that came in and had a GI bleed, for example, and they had massive blood loss, but the patient doesn't accept any blood work? What would you do in this situation? Now, for these type of questions, I memorized the ethics, of course, of do no harm, do good, and also being fair with all your patients. Also, another one is respecting the patient's autonomy. So basically, they have the decision about their health care, about the care that they will receive medically. So in this situation, how I answered it is that you, as a healthcare provider, your duty is to inform the patient about the risks that they may have if they don't accept any blood work. Also offer any alternatives if there are any alternatives, but in the end it is the patient's choice to make the decision according to their healthcare. So, or their medical. So this is a type of question that they will ask you. I know another question that I had was if there was, what was it? Say that there was 2 individuals on a kidney donor list. You had an old woman who was 65 and she needed a kidney, and then you had a 23-year-old woman who also needed a kidney. Who would you give the kidney to? The 65-year-old woman has lived a very healthy lifestyle, has made good choices in her lifestyle, and has taken care of herself. She has never had any issues, medical issues, aside from this, needing a kidney. And then on the other hand, you have this 23-year-old female who suffers from drug addiction, drug abuse, etc. So in this situation, who would you give the kidney to? Of course, in these situations, you can't play God and say you're going to give it to this person because of etc. So these type of questions, they just see how you think critically, how you would answer them. For this question, I said that I would give it to the individual who is 65-year-old because having a kidney transplant requires a lot of care, and the fact that the patient also has to be ensured that they are taking care of themselves, taking their medications regularly. And you know, in a situation, if we were to give it to the 23-year-old, from her past medical history, you know, one may not be sure whether they may be compliant in taking care of themselves or kidney. But once again, that's just how I answered it. They'll ask you these type of questions just to see how you answer them, and how you think ethically and morally. This is a really difficult question, but this is, I basically Googled and tried to ask also, I asked PAs I work with and doctors I work with how they would answer these questions and if they had ever faced these situations. And of course, almost majority of them had, and they answered to me how they had answered these questions. So for the first one, from the PA, he's the one who told me that as a provider, it's your duty to inform the patient about their health and try to guide them or steer them the way that will benefit them. But in the end, it is their choice because they do have autonomy and they are able to choose what they want in regards to their medical care. You are just there to inform them and to help them choose hopefully the correct choice. And then for the other one, from what I thought that the 65-year-old woman would need a kidney transplant because from her history, being that she has been healthy versus this other individual who was a drug addict or, still a drug addict, she may not be compliant with her medications or taking care of herself, etc. So, these questions can be a little difficult. If you do work with medical providers, definitely ask for their input. Research these questions also, and also try to answer your questions according to the ethics. The medical ethic is to do no harm, do the best for the patient you can, respect that they do have autonomy, and to be justice and fair with everybody. When it comes to justice, you can't deny health care to an individual who doesn't have any medical insurance or money. You have to be fair with everybody, no matter if they have money or not. So this is just where fairness comes into play. So, número 4, the final one, is also your situational questions. And these type of questions are going to see how you work as a leader, as a team player. They'll also learn about your communication skills with patients, with other professionals. Some of these questions that they may ask you is, what would you do in a situation that you were working next to a surgeon and you noticed that the surgeon's breath smells of alcohol? How would you react in the situation? Another one is, what would you do if you were working with a fellow coworker, whether it was a nurse, a doctor, PA, etc., and you witnessed that they were stealing medications? So these questions, I just want to see how would you communicate with the staff, how would you confront for example, the surgeon that seemed to have intaked alcohol. How would you communicate with them? In the case of the coworker, nurse, or physician assistant, or doctor, etc., who stole narcotics or medications, how would you confront them also? So in these cases, they just want to see your communication skills, like I said, your leadership skills, your teamwork skills, and yeah. So overall, 4 type of categories of questions they're going to ask you will be, once more, it's going to be the traditional questions, your behavioral questions, your ethical questions, and your situational questions. I will make more videos about each category of question and then examples and how I answered them. In my interviews, I got questions from all these categories, so it's really difficult to know what exact questions you're going to get, but it's helpful if you prepare yourself for these questions. So hopefully this video helped you guys out. If you guys like my video, give us a thumbs up. If you have any questions, if I stutter too much, if I talk too much, which I know I do, leave a comment below. Any feedback is really appreciated. I want to be able to make quality videos for you guys to help you guys get accepted into PA school. So hopefully my videos help you guys out. And if you are a first-time viewer, make sure you subscribe to my channel. I will be making videos more oftenly, and hopefully once I'm in PA school, I will be vlogging about my journey to PA school. Until then, I will try to make as much videos as I can, just providing you guys advice and tips and my experience of applying to PA school. Alright guys, thanks for watching my videos. Be blessed. Like I've said, work hard. Stay motivated, guys. Alright guys, I'll talk to you guys later. Bye.